What time is it? It's time for another Every Other Wednesday.
So, welcome. As you come in, you see some unfamiliar faces and you see some familiar faces. You see one kind of dark, obscure face here. That's because I'm in a place that's not really lit for
Are you
webinars.
in a witness protection program, Richard? Is
Yes,
that
don't
what's going
tell
on?
anyone. Don't tell anyone. Yes.
Don't call him Richard.
Okay.
Oh, wait,
Michael, when you say, are you in a witness protection program, Richard? That defeats the purpose of being
Richard Haddon.
I'm sorry, Fitcher.
Richard Haddon, who's also about to give his middle name because you're going to ask a question for the the chat box. Yeah,
I am. I'll put it in right now. Everybody, remember to change your chat settings to everyone, so it goes to everyone. We have a little alter ego name game. Tomorrow is Middle Name Pride Day. I believe Friday is Name Tag Day. So here, to come up with your alter ego name, those of you that subscribe for my newsletter will have seen this. The formula is based on this. It is your middle name plus the name of the town you were born in. So I am Douglas Penticton.
Hello, Douglas.
Douglas Penticton, and I am Edward Jacksonville.
I'm Inder Windsor. Lynn
Windsor.
Oh, you're born in Saskatchewan, Peggy? I'm assuming there's not many Estevans. Or a Mocto, New Brunswick? Nice.
And of all the places that I would put an Estevan, Saskatchewan would be the last place, if I were just to guess.
I've spoken in Estevan and Oromocto, which is why I know both those places.
Lee Athens, Emmeline, Toronto.
Those are good
Elizabeth
soap opera names.
Yeah.
Nice.
I wonder how many of them are evil twins that have returned to town to wreak havoc.
Excellent. Enough of your tomfoolery.
There's never enough of my tomfoolery.
Yes, Martin Albert, Joe Sturgis. Some of these are legit sounding names. Others of them, like mine, sound completely made up. All right. Well, gosh, we've got a group started in here, and it's about time. So why don't we go ahead and get started? Any objections to that, guys?
Do we have to vote?
Girls?
Are we voting now?
Okay, no, let's don't vote. No, let's don't. Yeah, it was yesterday was election day.
Was it though?
It was in the U.S. Super Tuesday.
I know, but it wasn't much of an election. I heard someone say that
we don't do politics here.
I know,
remember?
but it's not politics. It's smart assery. We do that. Someone said
that we do.
What's her face was going to sue Trump for assault because she was beaten so badly. So.
Oh no, oh, gosh. Okay, welcome everyone. Welcome to Every Other Wednesday. Hey, Michael, what day is it today?
I'm so glad you asked, Richard. It is Wednesday, March 6th, 2024.
And in addition to that, what day is it?
It is. Oh, look at that setup. Look at you with the segues. Thank you. It is
what?
It is Discover What Your Name Means Day today, Dentist Day to honor our dentists, Frozen Food Day, Oreo Cookie Day, and Day of the Dude.
Day of the Dude?
Day of the Dude. Oh, yeah.
Okay, well,
I
got it. By the way, is there a Day of the Do?
Of the Dude? Yeah, there should be.
Yeah, somebody got a hold of me and didn't let go. About a week ago, but they tell me it'll grow back. Hey, so again, welcome. We want to introduce our very special guest in just a minute, but we'd rather introduce ourselves first. So why don't we start?
So rude, so rude, Richard. So rude.
Why don't we start with you, Mike?
When I go to Richard's house for dinner, he eats first and makes me watch, and then he serves me. So
that's right.
Yeah.
Go ahead,
my name is Michael Kerr. I'm coming to you as I usually am from Canmore, Alberta, in the spectacular Canadian Rockies, and I write and speak about inspiring workplace cultures. And over to you, Mr. Sanjay.
My name is Sanjay Nath, and I'm a speaker and author focusing on leadership and performance. I'm based in just outside of Toronto, Ontario.
And I'm Richard Haddon, and I'm based in Jacksonville, Florida, but that's not where I am today. I am in the Minute Suites next to Gate B16 in Concourse B at the Atlanta Hartsfield Jackson International Airport, in between trips between Kansas City and my home in Jacksonville. And I'm an author and speaker, and I wrote Contented Cows Give Better Milk and all the other books that sound like that. So, but
and Richard wins the award for the most specific location identified.
I can give you my GPS coordinates. Yeah. And I have to mention the creepy eye behind me here, which I think somebody has decided based on the skin tone is an elephant. So I think it's an elephant eye.
It's a T-Rex.
You think it's a T-Rex. I think it's an elephant. So anyway, but what we're really here to do is to listen to our special guests today. And today we have Kandace Candace Fontenot, and Derek Yeagley. And they are both with Allen Parish Community Healthcare, which is a health system and hospital and other kinds of healthcare things in Kinder, Louisiana. And Derek is the cardiopulmonary and radiology director. And he's also, and I think this is really cool, and that's part of the reason that we're here today, he's the director of patient and employee experience there at Allen Parish. And then we have with him Kandace Fontenot, and Kandace is director of health informatics. So I can already tell both of these people are smarter individually than the three of us are collectively. But that's kind of why we invited them on. She has another title there at Allen Parish, and that is she is the Service Excellence Advisor Super Coach. And so that gives me an opportunity to explain a little bit about why we have invited them to be here today and why they are here together. Many of hopefully some of our audience members will remember about 2 years ago, we had a guest, Brian Lee, who is the founder and CEO of a company called Custom Learning Systems. And Custom Learning Systems specializes on employee and customer experience in healthcare, and specifically in smaller rural healthcare institutions and facilities. And so that's how we got to know Derek and Kandace. And Jeff Tobe, who, as you will conspicuously notice, is not here today. Jeff worked with Derek and Kandace very closely for several years as they develop what they're going to tell us about today. So you've heard enough from me. I'm going to turn it over to Kandace and Derek and ask you, first of all, to introduce yourselves a little bit better than I did, and to tell us a little bit about what you want to tell us with respect to the culture and the culture change that has happened there at Allen Parish.
Absolutely. And like all great men, they let ladies go first. So
Thanks.
I'll let you start it off.
Okay. Like you said, my name's Kandace Fontenot. I've actually my soap opera name is actually Elaine Kinder, because I was born here at this hospital. So I was actually born at the hospital I work in.
So you've actually been seen naked on site.
I have.
Yeah,
Each
wow.
one doesn't even know about it, so it's great.
Okay,
How does that work in the culture thing? Is that good? I don't want to know. Okay, forget it.
Well, that might be an offline conversation, I think,
Okay.
but we'll see. No, so I've been here since I was 19. So I'm
You didn't tell your
5
age?
years.
I'm 24 now.
Yes,
No,
so
I'm just kidding.
just a couple years.
I've been working at this hospital for 16 going on 17 years, and I've done different things throughout the facility, but my most recent job is I take care of the systems and to make sure that our EMRs work correctly and all of our information systems speak together. So I have to work with many different departments, but my favorite job here.
Let me just ask, does EMR stand for electronic medical records?
Yes, it does. Yes.
100 points to Richard.
Exactly. But my absolute favorite job here is being the Service Excellence Advisor Super Coach, because that allows me to work with frontline staff almost every day to get them engaged and to grow new leaders. So
what does that entail? Like, so what form? Are you meeting with people on a regular basis? Are you intimidating them? Are you beating with a stick? Like, what is involved?
All the above.
Yeah. So
And maybe it would also be helpful to answering Sanjay's question, to talk about what a service excellence advisor is. It's kind of a unique approach, and I think one that works really well. Tell us a little bit about that, and then about your role as their coach.
Okay. So a service excellence advisor here is a high performer, someone who doesn't just do their job. They do their job well, but they go above and beyond. They exceed those expectations, and they're chosen by their peers, by the directors. Sometimes they invite themselves. They're just like, "Hey, I would love to do this. Like, can I do this?"
Are they managers, or are they frontline?
No, they're all frontline staff. No, we don't have
frontline
no
staff.
leaders. It's all frontline staff.
Wow.
Yes. Which it's a different perspective, because they work with the patients, and here we like to utilize them. So we do training with them. We help them, they actually have to teach workshops to their peers, on service excellence, different things. But they do more than that. They get to grow as professionals. They're our future leaders here in our organizations. So we pick them based off of what we kind of see, what they do day to day. But I know that from day one, when we go into the first training and we say, hey, this is what you're going to have to do. You're going to have to talk in front of all these people. Some people have never spoken in front of anybody in their lives. And
Yeah, I can relate. Yeah.
to the last workshop is done, like they've fully transformed and they're ready to tackle any project that we give them. And it's just an amazing thing to see.
Wow, great.
Very cool.
Is it like an ongoing thing, or is it?
Oh, yeah.
Or is it like, so it's not, okay, come for 6 months and then
It's a year. So they serve a year term.
they do, okay.
Mm-hmm. And then we kick them out.
And they serve a year term. Presumably, is that to give as many people the opportunity to step into that role and to make sure they aren't burning out in that role?
Exactly.
Yeah.
And then also with that, a transition into a new role, as ambassadors for the new coming SEAs, to kind of guide as them as teachers as well, so they can not be alone in the process. First year was, the most difficult that we started. And we've been doing this with custom learning this will be our 4th year now. And so, again, first year for SEAs was the most difficult. We didn't know what to expect. They didn't know what to expect. But once we got through that and built that foundation, so to speak, everyone got more comfortable with it. And then our first year SEAs who transitioned to ambassadors, they knew what to expect, so they can translate that to the new people coming on.
Okay, so you've been doing this for 4 years. Give me a snapshot of a before and after, a day in the life of, like, what's been the difference? So yeah, you have an ambassador and a coach and yay, but are we seeing this?
Has Derek introduced himself yet, though?
No, that's okay. I'm used to that.
No, we wanna hear.
No, listen, part of my New Year's resolution is humility. So y'all are helping me out tremendously on that. I appreciate it. So like Richard said, I'm the director of patient and employee experience, and I'm also over cardiopulmonary and radiology. But more than that, I'm actually a respiratory therapist, and I've been doing that for 12 years now. And that's kind of where I started my journey. I was able to leave after I graduated and go work in many hospitals around the area, and then came back to my home of Kinder, to where I was actually born here in this hospital also. So, and I started my career as a manager right here. But before that, I worked at the behavioral health unit that we have as well. And I worked as a mental health tech while I was in school to be a respiratory therapist.
I was his boss at that time.
She was. Is a very interesting dynamic. And so that all transitioned and developed into what it is today, and that kind of says a lot for engagement and then culture as well, because this organization particularly really strives to grow people from within, and we're kind of living proof of that. I don't know if that's because if you do something well, you just get more tasks added to you. Or if you just stay so long, they'll finally say, okay, you can have it.
Okay, you can stay.
But either way, it's a very good environment that we have built. And so answering your question, Sanjay, we started 3 years ago with custom learning systems and got to meet Brian Lee. We met Richard and Jeff at these conferences that we would go to, the Healthcare Service Excellence Conference. And was able to get an idea, a different approach, if you will, on how to engage employees to raise their threshold, if you will, of satisfaction. And I loved how custom learning takes it from the frontline perspective versus top down. This is what you got to do. leaders getting all the training and trying to disseminate the information. And that's where the SEAs come in.
Yeah.
So what you really got is a
culture.
culture. I'm sorry. What you really got is a culture that, in that regard, is led by the front line,
Yes.
rather than as traditionally what we think of as being led by the top
Correct.
leadership.
Right.
Yeah. Okay.
Yeah.
And can you paint a picture for us what it was like before what prompted you to bring in?
Yeah, that's a good question.
Sure. Yeah, we went through we went through several different programs of service excellence, and all of them were tailored towards getting the leadership training and developed, and then, like I said, disseminating that information. And the way it was, we had really strong leaders at the time, very strong leaders.
But a great team of managers. But it wasn't getting down to our frontline staff. And so our survey scores showed that they were dissatisfied. And that ultimately affects your patients. You know, immediately they take care of your patients. Sometimes we don't see patients, and one day we might never see a patient. But they do.
You too, you mean in your particular role?
Yeah.
Sure.
Yeah. Because, as directors, sometimes we're stuck in our offices, and we had a great leadership team. It was just, our frontline staff was getting none of what we were getting. And so, that's kind of what it was for me before.
Right. And the being told, hey, we got to do this because of this, coming from that top-down approach wasn't working for us. And so when we flipped that to where the SEAs, their peers, are saying, hey, we get to do this because it's the best thing to do for our patients and for our community. It's going to keep people coming back, and coming from someone you work with is more receptive than getting somebody beating you over the head with a stick saying, hey, don't forget, you got to go do this kind of thing.
Yeah.
So
that's a really interesting, just a slight turn of phrase to say, hey, we got to do this because of this, to, hey, we get to do this so that we can do this.
Right.
Mm-hmm.
And
Very
we've
cool.
actually taken that approach and that lingo throughout everything that we're touching in our organization now, not just patient satisfaction, but quality as well. We get to provide quality care.
Volume. We get to see more patients.
Right. And our finances as well. When we do all of this, we get to have XYZ.
We get to have a huge party.
Because our financial return is better. So it's all encompassing and beneficial.
It's interesting you should say that about having a huge party, because I can tell from your dynamic, you guys are having fun. So, but at the same time, to implement something like this is a boatload of work. Talk to us about that balance, because it looks like it's a lot of work, but it's fun work.
Yes.
Absolutely. Yeah, and some people can get jealous about the fun that we have.
Right.
You want to start, or you want me to?
No, go ahead.
Okay, so what we have is a Service Excellence Council. And so this is actually made up of frontline staff and managers alike. So that way you have that good dynamic. So we know what frontline staff is saying, but we also have the leadership capabilities of managers who have experience in that. And this council is what governs the whole process, if you will, and kind of decides on the direction we want to continue going as an organization. So we oversee all of our patient satisfaction scores. We oversee all of the service excellence projects we have, and we also have we take into account what's working well, what we need to keep recognizing, and then what's not working so well, so we can put a bigger focus on that. Inside the council is made up of a bunch of different super coaches. So like Kandace is a service excellence super coach. We have Oasis team super coach. And when I'm going over this in orientation, custom learning has a plethora of
You used my word.
I used
You
it.
used my word.
Of
Acronyms.
Acronyms. And it took us 3 months to just figure out what all these acronyms mean. And so when I discuss it, and when we discuss it in orientation, I always say the O for Oasis stands for organizational wide. And so
I love that comment.
yeah, we did see. We're gonna get to the blue,
We're gonna get to it.
the blue fingernails in just a moment.
I'm sorry, which finger is that?
I love
Jennifer.
it.
Okay.
I don't think we both went like that.
Yeah, no, it's not the bad one.
Not that kind of show.
We'll
No,
get to that in just.
Well done, Jennifer.
Yeah.
Well done to
Nobody
notice
knows.
that.
Yeah. Well, it's a huge
I didn't
part of
notice that.
engagement. It's a huge part of engagement, so we'll get to that.
Right. And so the O for OASIS stands for organizational wide. This team is working on projects that affect the entire organization, something that one best practice that can be implemented that'll make the organization better. And then within that system, we have Do It Super Coach, and the D for Do It stands for department. So we're looking at department specific improvements, all the way from just a 1% change to something that's huge within your area that our frontline staff can come up with these ideas and also implement the project or the plan if it gets approved. So all that goes through, filters through the council, and it's kind of governed that way.
So it sounds like it's very specific things that are being done
Yes.
differently to improve the experience of your customers, which could be patients and could be employees and could be
Yes.
family members and all of that. Can you give us an example of one of these departmental improvements? I mean, you must have lots of them.
Oh, we do. We have so many. We actually did a clinic throughput Do It. Just as simple as
It's hard enough to say clinic throughput, but then when you add Do It to it, clinic throughput Do It.
Yes. The flag system, because we expanded on our clinic, so we got more doctors. So they had to use, some doctors had to use the same room. So just implementing, the staff said, why don't we implement a flag system? That way, if the red flag is up, it's for this doctor. If the blue flag is up, it's for this doctor. And they came up with that. The staff came up with that because they thought it was something that was going to, take less time. The doctor wasn't going to have to go search for, their patient anywhere, and they implemented and they're using it at our clinic now. So that's just one example of
And
just
so what's the bottom line result of that?
bottom line is they can see more patients.
Okay, so yeah,
Yeah.
And the patients get seen faster. They don't have to
Yes.
wait as long.
Mhm.
So some little something like that can make
And
such
our
a
docs
difference.
aren't mad, so that's a good thing too.
Hey, yeah.
And such a simple, low tech, low cost.
Yeah.
solution,
Yeah,
right?
flags.
Yeah.
I
Well,
love that.
not only are they seeing more patients, but they're spending more quality time with their patients
Wow.
instead of focusing on a
What do I
lot of
gotta go
different-
next?
Yeah, exactly. So they kind of have that process ironed out, which is
Yeah.
great.
So I was gonna reiterate Stephen's question in the chat box.
Yeah.
This has been reflected by your patients. You've kind of touched on that, and also in the pre-discussion, you were mentioning your patient scores on the ER. So,
Yeah, talk about
comment on
that.
Yes.
That was a huge we started that was one of the first things that we started working on whenever we moved to CLS. So I know that Derek's been the proudest of that. Because we had
And specifically what were things like in the emergency department before, what was done, and what are they like now?
Right. So we had long turnaround times or wait times in the ED. So it's not uncommon across America, right? But in rural healthcare, it's something you have to tackle and get done. Because we are serving a community that has options to go somewhere else.
Right.
And so our scores were reflecting poorly with not just throughput time, but also courtesy of the nurses, courtesy of the doctors. And so we actually implemented some of these processes in the emergency department to where our providers are now sitting down with the patients as they go in there, getting on their level and having a communication about their health care. Not often seen in an emergency department that's trying to, get people in, get people out for emergent situations, but we've taken a clinic approach to it, to where they're feeling like they are getting the best quality care that they can get. And our nurses have I would say, actually have led that initiative. And when we actually posted our scores and started making it a competition, saying, hey, this is where you're at, this is where we would like us to be, and kind of explaining the why behind it. Emergency room providers, if you've ever worked with them, they're very competitive and they want to compete with each other. So when we started doing that and bringing that awareness, that's what really made a difference. And it has brought us up to above the 90th percentile right now.
And that's
Wow.
something that's something can't be underlooked is when you can create a healthy sense of competition. And it's not ego driven, but you're fighting for the plastic dollar store trophy, right? It's bragging rights. And when you can create that in an environment, people just show up and it's fun and it's good brotherly, sisterly taunting. And it's, you laugh more and the day goes by quicker. But here's the other thing too, is the patients can smell it. They just kind of,
Yeah.
they feel more relaxed. They get it, as opposed to people that are, I'm doing my job. Don't look at me. Don't smile. Don't interact with me.
Interesting that you brought up smell, Sanjay. My sister is a retired nurse, and one of her favorite T-shirts that she used to wear said top 10 reasons to be a nurse, and one of the reasons was interesting aromas.
Hey, wait,
But-
Jerry has a great question I want to get to here in the chat box. How does your leadership team feel? Do they feel like they are losing control? That's a great question.
Okay.
To the-
So I can tell you
Speaking to
that
two of the leaders here, I think we'll be able to get a good perspective.
yeah,
Sure,
yeah,
yeah.
absolutely. So one, we didn't feel like we lost any control. We shared it within our respective roles. We shared it because we got to be a part of it and we had a good time with it. Other leaders who weren't as involved or didn't quite get it in the beginning, it was kind of like, well, this is my department,
Right. What's my part?
What's
in it?
what is my role in this? If they're making all these ideas and they're putting all these things into place, like what do I do? So it wasn't necessarily that they lost control or they sharing control. It was basically they wanted to make sure that they were fitting the role that was needed from their frontline staff. Like I want to make sure my staff is empowered, but I also need to make sure that I'm still managing my department appropriately. So we had to kind of go through some different trainings and just kind of get together and have open conversations on, specific scenarios, because it wasn't just like, well, what are we going to do? No. It was, we had to really get down and ask about, specific situations on, what lines they needed to let the employees cross and, with service recovery and making sure that they knew that they could help the patient. You don't have to go get a manager to help a patient. So, but
so giving them some guardrails, right?
yes,
Yeah.
yes,
That's good.
exactly.
Yeah.
It was more just about what their role was as the manager. It's, to continue to empower their staff and motivate their staff to, keep moving this service excellence initiative forward, and knowing, what they needed to do to keep managing their department. So we really didn't have any issue with any of our managers. We have really fantastic leaders here that just
And everyone
go with the flow.
has a job to do.
Yeah.
And so being that we are a smaller facility, we have around 25 leaders. We did assign different roles, different projects. So like we said earlier, some of them are on the council. Others are a part of running different projects or a part of our Oasis teams. So they have roles that they're doing. The piece of making sure, that transition of power into the SEA's hands, it's not really a transition of power more than you're engaging that staff to help you as leaders. And that's kind of what it's been viewed as. Now I have, not just me, but now I as a leader have these SEAs in my department that I can trust, that I'm building up to be future leaders in my area. So that way, if I ever leave or transition out of the organization, somebody's there to kind of pick up the mantle, so to say. And so, Jerry, to answer your question in the chat, it is more about bottom up leadership. It comes from the frontline staff. We empower and engage our employees to make decisions based on service excellence and how you can provide the best patient experience for people that are there, for outpatient, inpatient, whatever the case may be. They're empowered to do that without saying, let me get my manager for that.
Right.
And that gives the managers a whole lot more freedom to work on the stuff that's, that's
So I'm wondering
moving.
what happens if something does go wrong? What happens if somebody does have to wait too long? What if somebody gets, they had an appointment, they get there and they didn't have the appointment down, or somebody is scheduled for the wrong test or something like that? What happens then?
We have toolboxes just for that.
Tell us about your toolboxes.
We break out the tools.
We break out the toolbox. You go ahead.
We have a service recovery policy and program that we started. Now, we'll be honest with this. This was a little difficult to kick off and to get going. It when you're training individuals on how to do something, and and then having them document and do some of those documentations for tracking purposes. The documentation is some of the stuff that falls off, first and foremost, because they want to be
That's not the most fun thing to do.
Yeah.
right.
Right.
They want to be focused on the content, on what I'm doing with this. And so we have an escalation process to where if I'm a frontline staff and I have someone that's irate about their wait time and I feel like I've done everything that I can, we can escalate that process. But first we want and empower them to use the toolbox. So in there we have sample apology cards. We have thank you notes for bringing this to our attention. We have candy for kids.
Kinder bucks.
We have what's called Kinder Tender that you can use. It's not cash, but it's equivalent to that you can use around
In
the
town.
community in
Yeah.
town at businesses, and they'll accept that.
Oh, cool.
stuff.
So
very
not just
cool.
at the hospital
Right.
or
Right.
clinic. Okay.
The main thing key with that is it's not a bribe. Hey, here you're getting this.
Sorry.
It's
Yeah.
sorry for our service. Here, take this and shut up.
Yeah, take this and maybe that'll make
Yeah.
the problem go
yeah.
away. But is it more like you said, to thank them for bringing it to your attention?
Exactly.
Because so often in healthcare, well, I think anywhere, but especially in healthcare, customers, patients, if you will, are afraid to bring it to your attention because they might unplug my ventilator or something.
Right.
I don't know. Yeah.
Right. And that's
Unplug the
part
ventilator.
of using. I mean, hey,
Never
I don't know
at
if
Allen.
you're going to be knowing that they're going to unplug it. But
Never at Allen Parish, but yeah.
So I have a question on kind of on that front. As you were undergoing this change, was there any pushback just based on the fact that you work in a healthcare system? I guess what I'm getting at, we have people on our call here from all sorts of different cultures, government, private sector, but I think we all tend to think of healthcare as being somewhat different, right? Culture is culture. But did you have pushback where people said, we can't do that. We're a hospital. We're in the healthcare business. Like those rules can't apply here. Did you have any of that? And what do you think do you have some unique challenges maybe that other cultures don't have?
Yeah, we did at first, and it wasn't, I don't know if it was necessarily yeah, it was healthcare. It's because we're actually dealing with people. So if you're trying to do service recovery because someone got sticked with a needle 5 times, like if they couldn't find a good vein and they got stuck 5 times, that's a little bit different than, going in and, having an altercation with someone who's bagging your groceries. You know what I'm saying? So, we have to take into account that, sometimes that we can cause harm, not just physically, but mentally, emotionally, and not with just the patient, with their families. So we're not just dealing with the patient, we're dealing with the family members as well. And sometimes the patient is fine, but the family is upset. So it's the dynamic of it is it's just larger in the way I feel. It's a larger piece of customer service and making sure that whenever we recover the service, it's not about, I'm sorry, or, we want to do better. It's more about, thank you for letting me try again. Thank you for allowing us the opportunity to be better for you. So.
Yeah, and we're dealing with a population who, especially on the inpatient and emergency room side, that are coming here on some of the worst days of their lives. They're sick, they're hurting, they're in pain. And that automatically raises the level of anger or content as to who's treating me and and so that's why it's so important that every interaction is met with kindness and compassion, and also an explanation of I'm here to care for you today. It's not a hey, you're just another patient on the list, and I got to get through it. It's and that's kind of
like talking about the total hip in room 308 or something like that.
Right.
Like they're nothing but a series of sinews and muscles and fluids.
So I have a 2-part question, and it's not really a 2-part. It's 2 completely different questions, but I'm just going to call it a 2-part so I can ask them both. You guys are in rural Louisiana.
Yes.
You don't have a huge budget. I've actually looked at some of the stats of your community and in terms of income and age, and You don't have people beating down the door going, let me in. You probably have high turnover. You have scarce resources. You're not working with a big budget, and yet you're still able to make this transformation.
Yeah.
How? And then part two of the question is this.
Yeah.
You
Oh,
never
yeah,
answered this
of
question.
course.
Yeah, that was
We have a really great leader, a really great CEO who has a vision and has had a vision for the past 9 years that she's been here to build a new organization, but an organization based on quality care for rural communities. And so that vision that she's had has not wavered. And it shows because we're actually in the process of building a new facility at the moment.
Wow.
So
yeah, we'll be opening. I think we're opening in August.
Yeah.
Our new half of our new facility. So we're very excited. But she's never stopped. Even with the turnover in leadership and some turnover in frontline staff. The message has been very clear and the same. This is the way we're going. We got to find a way to make this work. And she's also been a huge reason why Derek and I are sitting here today is because she's grown. She's not just about telling us what to do. She's actually a coach, and she's training her leaders so that she knows she's not going to be here forever. She wants us to be able to sustain things, regardless.
Yeah, and the question about financials, or for the financial people there, how do we sustain it? You can't, I'm going to do a double negative here, but you cannot not invest in your people.
Yeah.
You have to invest in your staff for you to be successful down the road, because, we can get some really good, really good clinical folks and really good analytical folks on board. But if they're not compassionate and driving that fluffy stuff that people like to call it,
the warm and fuzzies,
then
The
it's
soft
only gonna
stuff
be
that seems to be so hard.
It is, and it's not an easy thing to do. We're talking about people's personalities here, and we're not talking about changing their personalities. We're talking about incorporating their specific personalities into
what works for you.
Yeah.
And I also wonder if it's because of the community nature of where you are. Is there something about people saying, well, we're caring for our neighbors and people that maybe that we've grown up. I mean, both of you have lived in Kinder most of your life, I would imagine. And I imagine there are a lot of people that are that way too.
Yeah,
We've got another
people at the grocery store.
Yeah, we see them all everywhere.
Yeah.
The ballpark,
Right.
Their kids, at the school, so.
So Stephen, thank you. So Stephen asked the question, are there any tangible parts of the process like a certificate? I can answer that. Yes, there's a certificate, but there's more. But wait, there's more. Or some reward like time off for the frontliners. I don't know how you specifically do that. I know that there is an opportunity, a potential opportunity for your frontliners, for your service excellence advisors to attend the national annual conference that CLS puts on, which is a pretty
amazing.
Good experience. Yeah.
Amazing.
Yeah, so there's that. Is there anything
SCAs.
else that you guys offer for your SCAs?
yeah.
I mean, I know you party a lot. There's food involved.
So we really do. Derek and I really go all out for these guys who just lay it all out for us. Our SCAs, our frontline staff who really get involved. Derek and I really, we make their graduation a huge event. And then we celebrate after the workshop. So after they've done all this hard work, we have a huge party for them. And they all get certificates and candy, and we talk about them, just their special little speeches for each of them. And we do it in front of all of our leaders, all of our directors, all of our leaders and their families. So they invite their families. We have cake. We have
cake. You had me at cake.
Well, it's true. Yeah. We always have cake.
cake.
And then they, like Derek said, they also get the opportunity to attend the conference at the end of the year.
That's great. Great. Thank you. And Carol has a question. And Carol, I'm just so glad to see you're here because I didn't see your name earlier. So I'm glad you're here. She says there's always situations where certain people are just jerks. Mike, that's your cue to bring out the jerk-free workplace book. Is there ever a time when you recognize that someone, I guess you mean a patient or we're going to get to the blue fingernail, a patient or other customer who's just a jerk? Is there something that you can't accommodate? I think I know the answer is yes. So sometimes, the customer's not always right, but the customer is always the customer.
Yes.
What do you do in those really tough situations when you can't accommodate what the customer is asking for, but you still want to give have an excellent
Well,
experience.
that's when you pull out the experts. That's when you
Okay.
have to absolutely find the best person in your facility. You have to know that person. You have to know that person. You have to.
Okay, so who's going to be the best one to come to the rescue on this
Yes,
situation?
you have
Oh,
to
that's
you
good.
have to have that person. Every facility has that person. They may have
Yeah.
5 of those people. Every facility has that person who can talk to anybody to de-escalate any situation. Maybe not to the point of resolution, but just to a point where there can be a conversation. Even if there's no resolution at the time, there can still be a conversation. There's always, you have to make sure that you know that person, you're friends with that person, and you have their number.
Yep.
I call those people the jackass whisperers.
Yeah, I like that
exactly
term.
what
Give
it
I
them,
love
give
that.
them a
You're
prize for the best
awesome.
jackass whisperer of the month.
I love that. We only have 5 minutes left, and I want to get at least 2 things covered.
And I have
Mike
a question
is
too.
champing at the bit. So the first thing is about, you got to talk about the blue fingernail.
Okay.
Blue fingernail.
Yes.
Colon Cancer Awareness Month
Yes.
is March. So as part of engagement, our staff actually, some of our nurse liaisons,
Our ambassadors.
they are ambassadors, yes. They actually went around and, trying to raise awareness for this and offering, hey, can we paint your fingernails so that way we can all be on the same page and recognize, what am I trying to say?
Raise awareness.
Raise
So
awareness
it's a
for-
conversation starter. Like, all these people want to know why we.
What that is. And so it's,
So it's a little bit like a
raise
band or a rubber band or something around your wrist that somebody might ask a question about, but yours is even more different.
But it's just one
Yeah.
finger, so it's odd.
I
It's
know.
not,
And what
Yeah.
it is that you should be screened at 45 now,
Right.
not 50.
When I reach that, I will.
I'm just letting you guys know, 45 instead of 50 now. Blue finger, correct? We gotta save people's lives.
Small things though, small things
Here,
like
I
that.
thought you just banged your finger.
Yeah.
Yeah, no, that is great.
Hey,
So go ahead, Mike.
I want to get to my question that we talked about before the meeting. So I'm speaking in April to emergency room nurses in the Canadian healthcare system. Very different, right? Public healthcare. They are feeling overwhelmed, overworked, short-staffed, short-resourced, at the end of their rope. What advice, based on your experience, would you give a room full of emergency room nurses in that situation?
This is a tough one because emergency room staff is primarily there to get you in and out as quickly as possible and make sure that you're not dying, right? Yeah. And that's what a lot of people feel. A lot of the staff feel that way. And so doing extra things, the thing you have to do is explain why, what is this going to impact for me? What will this do for me as an emergency room nurse, and how will it benefit me? And what you'll get, or what they'll see, is that if you're doing these extra things, just these small things, it's just about connecting with people. That's the number one thing. Just make a connection. All people want to feel heard, right? We go back to this jerk situation. The easiest way to get a jerk to calm down is listen. Just listen to them and let them spell it all out. So that
Sanjay,
way,
is that true in your experience?
Call me a jerk. First of all, I hand out the insults. I'm not the butt of them. Okay. So.
Okay. I'm sorry, Derek. Go ahead.
No, yeah. So, but that's the first thing is just making sure that you explain the why. Why is it, and what impact is it going to have on them, and kind of getting them to see that it's beneficial to them and their patients that they're caring for. Yeah.
So really, I guess,
good advice.
appealing to the impact that they're making on others. Yeah.
And
I love it.
On top of that, a lot of the times what we hear from our nurses, for people to, I know this is, if you're speaking to the nurses, it probably wouldn't be helpful, but if you would be speaking to like their leaders or people who work with them, or other service lines that work, with the emergency department, just having someone check in, not need anything, not want anything from them, go in there, hey, how's the day going? Do you guys need anything? Whether it's their manager, whether it's somebody like Derek or me, just to walk through, check on the doc, check on the nurses, make sure that they don't need, a break from answering a phone, or just making sure that they have somebody there, because sometimes they feel isolated in the ER because it's so all the time.
So fast paced, isn't it? Yeah.
Right, exactly. And so you feel isolated. And when the rush is over, it's just like, ah, okay, I need someone to
Yeah.
come check on me now.
Yeah.
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 Great-
Caring for the
great
caregiver.
advice. Thank you. Thank you.
Wow, great. Well, I can't believe there's time for us to sign off now. Derek and Candace, I tell you what, I mean, our audience knows this. You did not have to do this. There is nothing that was compelling you to do this except that you're good folks, and so is Jeff, and you wanted to do something good for Jeff, and you have done something great for us and for our audience, and I've thoroughly enjoyed it.
We were
Oh,
excited.
we're so
we
excited.
get to be on TV with
Yeah.
celebrities.
Yeah, even if it is with us, yeah. So, hey guys, when are we going to get to do this again?
Oh,
Anytime you want.
anytime, we're available.
We are ready.
Okay, we might come back and do a check-in on you in
I
a
love
while.
it.
Yeah.
We love that. We
So
might have
Sanjay and-
our fingers painted.
Yeah.
Oh, I want to know all about that. So Sanjay and Mike, when are we going to convene again and do every other Wednesday?
March 20th. And the cool thing about March 20th is it is birthday episode because Jeff's birthday is March 21st.
Yeah.
And yours?
March 21st?
No, Jeff's is March 21, mine's March 24th.
And I'm March 28th. So we're having a
Nice.
party.
Yeah.
Wow.
And my wedding anniversary is March 28th, so we'll just have a big party.
There you
Yeah.
go.
Let's do it.
All
Mine's
kinds of-
not till August.
And I'm not going to be here March
I'm
20th. I think
coming.
I'm speaking.
And that's how we're celebrating.
You're speaking. You're speaking to yeah.
Hey, Candace
All right,
and Derek,
everybody.
thank you so much for
Thank
your
you.
wisdom,
This has
for your
been
time,
great.
for your
Really
passion.
enjoyed it. Appreciate
Yeah,
it.
that was
Okay,
fabulous.
everyone. We'll see
Thank
you
you
every
so
other
much.
Wednesday.
Cheers.
Thank you
Bye.
all.
Thanks.